Hello everyone. Today's video is about testing for mold and testing for small intestine bacterial overgrowth. Before I jump into the video, if you don't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need health advice, please talk to your healthcare provider to get that advice. So someone posted a question on one of my other videos asking what are the best tests for assessing mold in a person's body and what are the best tests for assessing bacteria levels in the small intestine. So thank you for those questions. So when it comes to testing for mold in the body, there's the test that I think is the most useful is running something called a urine mycotoxins test. The urine mycotoxin test is a test where a person produces a urine sample, typically a first morning urine sample. They send that off to the lab, and then they analyze the urine for the presence of mycotoxins. Mycotoxins being the toxins that are produced by the mold that generally have the most harmful deleterious effects on the tissues in the body, whether that's negatively impacting the mitochondria, the brain, the kidneys, the nervous system, etc. That's, in my opinion, the most useful test. With that being said, with that test, we do have to take into consideration possible confounding variables. So, for example, if a person's consuming a lot of foods that have a mycotoxin contamination to them, then that's something that could give you a false positive potentially. So when I recommend mycotoxin testing for my patients, I'll recommend that for at least 48 hours or so leading up to the test collection time that they avoid common mold contaminated foods such as grains, alcoholic beverages, fermented foods, melons, cheeses, anything that's kind of aged or fermented. Those would be things that might be more prone to having mycotoxins in them. So there's that. And then also just bearing in mind the method of the testing that's being done. So the lab that we typically use is called Mosaic Diagnostics, formerly known as Great Plains Laboratory. The methodology that they use, to my understanding, test for very specific forms of those mycotoxins, not the metabolites of those mycotoxins. So I recommend for my patients, if they're going to do that particular test, to avoid taking glutathione or other things that might help to boost up glutathione levels or contribute to sulfation reactions in the liver, because we don't want to have the patient be kind of breaking down those mycotoxins into forms that the test can't pick up, and that would confound the results, obviously. The other thing that I think is important that I recommend for my patients, and again, if a person listening to this is planning to pursue mycotoxin testing, please follow the recommendations from your healthcare provider. This is again just for informational purposes, but what I've recommended to my own patients for years prior to doing a mycotoxin test is I recommend that they do something to make themselves sweat for about 20 to 30 minutes leading up to that test, whether it's exercise, which many of the patients that do this testing are feeling too unwell to do exercise, or at least to exercise that vigorously where they'd be sweating for 20 to 30 minutes. So it can certainly be a passive sweat, like in a sauna, or as I'm fond of recommending to my patients, if they can't exercise and they don't have access to a sauna, as many of them don't, that they can just kind of put themselves in there, like go into their bathroom, close the door, crank up the heat, put on a couple layers of clothing, watch Netflix or something like that, and just sweat it out for 20 to 30 minutes, and voila, kind of a built-in sauna, or homemade sauna there. But the purpose of the sweating is essentially to help try to disperse the mycotoxins from the patient's tissue, so we reduce the risk of getting a false negative if, say, the mycotoxins are there but they're kind of stuck inside of the cells. There's not much floating around in the bloodstream because the lymphatics are compromised, they're congested, detox pathways are clogged up. We might not see as many mycotoxins coming out. And indeed, when I started recommending that to patients, because when I first learned about mycotoxin testing, that wasn't a recommendation that I was taught, so I never really thought about it, then heard about it at a conference, thought that makes a lot of sense, started recommending it, and lo and behold, the numbers that we see coming out of folks around their test results when we do the provocation with that sweating provocation is generally on average quite a lot higher than when folks don't do the provocation. And of course, sweating doesn't somehow magically imbue their body with mycotoxins. It's not like the equivalent to say, oh, I'm just going to eat a whole bunch of cheese and melon and grains and then do the test. It's something that I believe is genuinely working to help better flush those mycotoxins out of the body, which is likely why so many folks do report feeling improvements when they do sauna therapy when they're dealing with mold mycotoxins. So that is my favorite test to recommend for testing for mold in the body. The other question around testing for bacterial overgrowth in the small intestine, There are a couple of tests that are available, but the one that is the most accurate, in my opinion, is something called the lactulose breath test. So the lactulose breath test is a test that involves doing a very bland, boring prep diet, doing an overnight water fast, and then collecting breath samples every 20 minutes the next morning. Works out to be over a 3-hour period because it's 10 breath samples. In between the first and second sample, the patient needs to consume a solution of something called lactulose, which is basically a sugar that the SIBO bacteria can chow down on. So that prep diet and the fasting kind of like puts the bacteria into a hunger strike mode. It kind of establishes a clean baseline, and then once that lactulose is consumed, the bacteria are going to gobble it up and then create gas as a byproduct of their metabolism, and then that's what we're testing for in those subsequent breath samples. So if we see elevated levels of hydrogen gas or methane gas or hydrogen sulfide gas above certain cutoff thresholds, then that's generally considered to be diagnostic for SIBO. So in my opinion, that's the best test. The other test that's available is a glucose breath test, and the proponents of a glucose breath test will say that there's more research literature supporting the use of a glucose breath test. That's, in my opinion, highly debatable. If memory serves, I believe I created a video talking about this topic before, about kind of like the validity of breath testing for SIBO, so I won't recapitulate that now or in this video. But in my opinion, the premises upon which there's sort of proponents around the glucose breath testing, it's a superior test based on the research literature. I think that those, they're kind of built on inaccurate pretenses, shall we say. And so anyways, I won't get into it here, but in my opinion, and I would dare say my learned opinion, and that I've literally taught I put together and a few years ago taught a clinician course on SIBO, so steeped in the literature, looked at all of this, and under with a fine-tooth comb. I think that the lactulose breath test is far superior. Even folks who are proponents of the glucose breath test, they'll be generally the first to admit that the glucose breath test is only able to assess the first, I believe, 20% of the small intestine. So it doesn't assess the entire small intestine as, in my opinion, the lactulose breath test does. So even if the glucose breath test is in some way a superior test, it's really only giving a small snapshot of the whole small intestine. So if a person gets a positive SIBO result, like a positive glucose breath test, okay, that's SIBO. But if it's negative, it doesn't mean they don't have SIBO. It just means they don't have SIBO in that first section of their small intestine. So the lactulose breath test is really the test of choice, in my humble opinion. So thank you for those questions. I hope that this information was useful. If anybody has any questions on this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.